Hi everyone, I'm Lauren and I'm the Pink Dental Therapist, and in today's video I'm going to give you some advice on how to look after and care for your denture. So there are many different types. You can get a silver chrome denture, an acrylic denture which is flexible or non-flexible, and you can get a denture that's fixed onto implants. All of these I treat in exactly the same way. So number one would be try and take your denture out at night time. This will give your mouth a chance to breathe and to rest. If you feel like you might not want to take your denture out at night time, I would take it out at a separate time of the day, for example when you go for a bath or a shower. And as doing this will help to prevent oral mouth infections such as oral thrush and denture stomatitis. When you take your denture out, always leave it in water. So a glass of water or a little denture bath, just like this. You can get it from the vet range, very cheap, and then it's safe. And by keeping it in water, you're going to prevent any plaque or germs hardening on the denture, which makes it more tricky to clean off. Coming on to cleaning, so I would recommend cleaning your denture 2 to 3 times daily with Carex hand soap. So what I would do is fill up your sink of water, put the plug in, so then if you drop your denture it's less likely to break as they can be quite fragile. Then I would get something like a denture toothbrush or just a manual medium textured toothbrush, and with the Carex hand soap mixed in the water, dip the brush in and do small circular motions. You can submerge the denture if you want to, and make sure you're getting in everywhere, cleaning all the way around any clasps and all of the teeth inside and outside, 2 to 3 times a day. If you feel like your denture is starting to get a little bit stained, or you feel like it just needs a bit more of an intense clean, once a month you can use Sterident or denture cleansing tablets. So what you would do is get the tablet, dissolve it in mild room temperature water, not too hot, let it dissolve, leave your denture in there, leave it for 5 minutes, and then it's good to go. It's lovely and clean. Just rinse it and you can pop it back in. The reason why we say not to use too hot water is because potentially you could change the shape of your denture. So that's also really important to bear in mind. And I also mentioned to only use a Sterident once a month. That's because these tablets can be quite strong, so only use it if you feel that it needs it. There's a pigment in the pink colour of the gum tissue on the denture called cadmium red, and that can be bleached or the colour can come out if the Sterident is used too much. If you feel like there has been some plaque on the denture and it's hardened and it's calcified and it's turned into calculus or tartar, that cannot be cleaned off at home with your toothbrush. Sterident often doesn't get it off. Us as a hygienist or a therapist, we can clean it off, but there is a very high risk that it could get scratched. So we would recommend sending it off to a dental technician. They can usually do about a 2-hour turnaround, and you're looking at about £30 to £40, and they clean it professionally. So it might be worth doing this every 6 months when it comes around to your hygiene appointment, or once a year, and they're quite happy to do that for you. Any questions, just get in contact. I'm the Pink Dental Therapist. You can find me on Facebook, Instagram, and I'm at New Street Dental Care. Take care.